Hello everyone. In today's video, we'll be discussing about the hormonal methods of contraception. The objectives of this session to understand the classification, the mechanism of action, adverse effects, contraindications and non-contraceptive benefits of hormonal contraceptives. Starting with the classification, hormonal methods are broadly classified into two. We have oral pills and depot formulations. They are oral pills and depot formulations. The first one, under oral pills, we have 5 subclassifications. We have total of 5 subclassifications. They are combined pills. They are combined pill, progestogens only pill, POP, progestogen only pill, post-coital pill, once a month pill, male pill or gossipol. So now, under the post-coital pill, post-coitus, it can be in the form of IUDs or hormonal. Hormonal includes the mini pill, that is progesterone only pill, high doses of estrogens, anti-progestogens. So 3 hormones you have to remember. They are mini pill, progesterone only pill, high doses of estrogens. Then we have progestogen and high doses of estrogen. This was under the post-coital pill. What are the 5 subheadings, guys? Combined pills, progesterone only progesterone, or it could be combined. Or we have post-coital, under which we saw IUDs and mini pill, high doses of estrogen, anti-progestogen. Once a month pill, male pill, popularly with the thing known as gossipol, male pill also known as gossipol. Fine. Now the oral pills are clear. Now let us move on to depot formulation. Under depot formulation, we have 3 headings to remember. They are injectables, subdermal implants or subcutaneous implants, and we have vaginal rings. Starting with the injectables. Under injectables, we have progestogen only or combined. Progestogen only, or it could be combined. Under progestogen only, DMPA and NET-EN. Combined, we have cyclophem, cycloprovera, mesigma. And subdermal implants contain norplant and norplant R2. The third subheading is vaginal rings. I hope it's clear, guys. Now, let us list them out. What are those 3 headings under depot formulations? We have injectables, subcutaneous implants, and we have vaginal rings. Under injectables, remember progestogen only combined, DMPA, NET-EN, combined cyclophem, cycloprovera, mesigna. So clear. Now moving on. So the classification, I hope it's very clear. 2 broad headings: oral pill, depot formulation. Under oral pill, 5 things: combined, progestogen only, post-coital, once a month, male pill. Depot, injectable, subcutaneous implant, vaginal rings. Starting with oral pills. Before going to oral pills, let us know about the hormonal methods of contraception. What do we have to say about the hormonal methods of contraception? These hormonal contraceptives, when they are used as the most effective spacing methods of contraception to space between one child and the other child. The spacing method, one of the most effective method, is hormonal contraceptives. We see that oral contraceptives of the combined type. In oral contraceptives, we have 5 types, right? What we saw. Under which the combined type are almost 100% effective in preventing pregnancy. How beautiful is this? They are so effective, 100% results they give. 100% effectiveness in preventing the pregnancy. They provide the best means of spacing the childbirths. We see that 65 million in the world are estimated to take the pills. All over the world, 65 million women are males and the females together are taking the pills. We also have to keep in mind OCPs. We also have male OCPs, gossipol, and the others which we'll be dealing in the upcoming slides in the other half of the session. And also remember that 9.52 millions are to be Indians. Let us start with the oral pills, that is combined pill. Under the combined pills, we know that it is one of the major spacing method of contraception. What is the content? So we are dealing with combined pill. It contains levonorgestrel and ethinyl estradiol. So this is very important. You have to remember levonorgestrel 0.15 mg, ethinyl estradiol 0.03 mg. How much? 0.15. 0.15 is what? Levonorgestrel. And 0.03 mg is ethinyl estradiol. Levonorgestrel and ethinyl estradiol. It contains 28 pills. So let us look into the picture here. Here, this what are we dealing about? The combined pills. They will contain 21 plus 7 pills. These 21 pills are given orally for consecutive days. So we can see this here. It contains, one row contains 7 tablets. So 3 rows, so 21 pills plus these 7 are iron tablets. I hope it's clear. 21 plus 7 tablets are given orally for 21 consecutive days beginning on the 5th day of menstrual cycle. So we see that this OCPs have to be given for 21 days. When should you begin this OCP? On the 5th day of the menstrual cycle, followed by a break of 7 days during the period of menses. That period of 7 days, it should be given a break during which the women will be taking those iron tablets. Okay. They deliver the same amount of estrogen every day from the first 21 days of the cycle. It is followed by a break of 7 days during which the menstruation will occur. The woman will take 7 brown iron tablets which are given during this period. She will take those 7 brown film coated, brown film coated 60 mg ferrous fumarate tablets. OCP is a method of choice especially for the newly married couples. So what is the best choice for the newly married couples? OCPs. There are 2 types of OCPs. We have Mala N and Mala D. So guys, we see that there are 2 OCPs, Mala N and Mala D. First look at the pictures here. This is Mala N and this is Mala D. You can see Mala N and Mala D. Cool. Now let us discuss about them. Mala N and Mala D. What is the difference between these two? It could be your Viva Voice question. So this Mala N is given free of cost under the national program. It contains ethinyl estradiol 0.03 mg, levonorgestrel 0.15 mg. It contains 21 plus 7 tablets as we saw in the picture. And moving on to Mala D. Mala D is rupees 3 per packet. It also contains ethinyl estradiol 0.03 mg, levonorgestrel 0.15 mg, 21 plus 7 tablets just like in Mala N. So what is the main difference? So you can see here the content, ethinyl estradiol and levonorgestrel, it's same in both of them. The number of tablets is also same. So where does the difference lie? It's in the cost. The Mala N is provided by the government under the national program N for nil, 0. It's free of cost. Whereas Mala D, D for dollar, that is it is costing us 3 rupees per packet. This is the difference. It is free of cost. Mala N is free of cost, whereas Mala D, it is rupees 3 per packet. So now the difference we are done. Moving on, recommendations in cases of missed OCPs. If a woman misses one pill, she should take the pill as soon as possible. In case she misses 2 pills, then she have to stop the current pack of OCP. She should continue with the barrier method for the rest of the month, and then she should test the pregnancy towards the end of the cycle. If the OCP has worked and then she is not pregnant, from the next month, from the 5th day of the menstrual cycle, she can continue her OCPs. Now, if the woman misses 1 pill, she should take the pill as soon as she remembers. In case the day has passed, it's her next day she is remembering that she forgot to take the pill yesterday, ask her to take 2 pills on that particular day and then continue with 1 pill as usual. Now, if the woman comes to the clinic and ask about when should she take the pill, preferably it is before going to bed at night. The first course should be strictly started on the 5th day of the menstrual period. If the woman deviates in respect to this, then the OCPs may not prevent the pregnancy. They can land up having a being conceived. So we see that if the user forgets to take the pill, she should take it as soon as she remembers, or the next day she should take it 2 pills at the usual time. Now, moving on to the progestogen only pill. So we are clear with the combined pills, right? Combined pills, Mala N, Mala D to remember, ethinyl estradiol, levonorgestrel 0.03 mg and 0.15 mg to be in mind, and 28 tablets. And regarding the missing of all that, we have done. Now we'll be dealing about the progestogens only pill or mini pill or micro pill. Progestogen only pill, also known as POP. Mini pill, micro pill. It contains only progestogen, which is given in small doses throughout the cycle. The commonly used progestogens are norethinosterone and levonorgestrel. So we see that only progesterone. It never gained the widespread use because of the poor cycle control and increased pregnancy rate. This progestogen only pill, it was not widespread. People do not use it as much as the other pills. Like in combined pills, it is broadly used by 65 million over the world. Whereas here the progestogen only pill, which is a mini pill, micro pill, it is not that widespread. It's because there is increased pregnancy rate. They could be prescribed to older women in whom the combined pill is contraindicated because of the cardiovascular diseases. In such women, you can go with progestogen only pill. In young women with the risk factors for neoplasia, this can be considered. Now, something very confusing, but you have to remember it if you want to. For progestogen only pill, just know that it never gained a widespread use because it was having a very poor cycle control. Pregnancy rates were high, high failure rates, and it can be given to old women or women with malignancies. It can be used for lactating mother under RCH. Ectopic pregnancy may be seen in cases of progestogen only pill. Usually what happens, OCPs prevent ectopic pregnancies. In order to prevent the ectopic pregnancies, the menstrual irregularities, then if post abortion, all such cases, what do? We prescribe OCPs to the woman to rest her cycle. But here they cause ectopic pregnancy. The progestogen only pills may cause ectopic pregnancy. Moving on to postcoital contraception, which is the postcoital pill, also known as emergency contraception. It could be in the form of IUDs or hormonal. In the first place, postcoital or morning after. The contraception is recommended within 72 hours of unprotected intercourse. So we see that it is recommended within 72 hours of unprotected intercourse. Most common side effects could include nausea. The failure rate is very less than 1%. So there are two methods. We have IUDs and hormonal. We have IUD and hormonal. Under the classification we had seen, The IUDs, the simplest technique is just to insert an IUD if it is acceptable to the woman, especially a copper device within the 5 days of unprotected intercourse. It is 99% effective, more effective compared to the emergency contraceptive pill. IUD is very effective. Remember guys, IUD can be used as a post-coital contraceptive in which a copper device is inserted within the 5 days of unprotected intercourse. Moving on to hormonal. Under hormonal, we had three things, that is mini pill, that is progesterone only pill, high doses of estrogen, and anti-progestogen. Under mini pill, it contains levonorgestrel 1.5 mg single dose within 72 hours. So we see that most often a hormonal method is preferable. In India, levonorgestrel 1.5 mg is used within 72 hours. The drug of choice for the emergency contraceptive could be levonorgestrel 1.5 mg. And then the high doses of estrogen, that is 5 mg OD into 5 days. Anti-progestogen, that is mifepristone RU486 10 mg stat within the 72 hours of coitus. So guys, we see here that once in 24 hours, once in 24 hours the mifepristone 10 mg can be given. In cases of estrogen, we saw that 5 mg OD into 5 days. So this was all about the hormonal. USP and Lancy method. Now they are talking about the USP and Lancy method. The combined oral pills are generally accepted as a preparation of choice for emergency contraception. As this contains very less side effects, we saw what was the side effects of this pills, that is nausea. So we see that it has a very less side effect. The regimen to be completed within 72 hours of coitus. Very important thing to keep in mind is you have to start the regimen and it has to be completed within the 72 hours of coitus. 72 hours, okay. The regimens are as follows. The current recommendations pills with 30 mcg of estrogen. In cases of 30 mcg or 35 mcgs of ethinyl estradiol or estrogen, they have to take 4 tablets immediately and 4 tablets after 12 hours. So we see that 30 mcg. In cases of 30 mcg, 4 tablets plus 4 tablets. Then moving on to standard method. Under the standard method, the pills which are containing 50 mcg of ethinyl estradiol, 50, they have to take 2 pills. 2 pills immediately followed by 2 pills 12 hours later. In cases of pills containing 200 mcg estrogen or ethinyl estradiol, 200 mcg just 1 pill will suffice, followed by 1 pill 12 hours later. So always remember the regimens. What are those? We know mifepristone 10 mg once within the 72 hours. Mifepristone just 10 mg will suffice. Now we are only dealing about the USP method, wherein the recommendation in cases of 30 mcg 4 pills followed by 4, 50 2, 200 1. Cool guys, it's clear? Fine. Next, moving on to what is the name? USP and Lancy method. USP and Lancy method, the regimen has to be completed within the 72 hours of coitus. Moving on to the fourth thing, fourth classification, we have once a month pill. Once a month pill, which is a long acting pill. You know the experiments with once a month oral pill in which the Quinestrol is a long acting estrogen. What is the long acting estrogen known as? Quinestrol, a long acting estrogen, is given in combination with short acting progestogen. So this combination has been given. It's not that pleasing. There have been lots of disappointment with such experiments. The pregnancy rates were too high to be acceptable. In addition, the bleeding also tends to be irregular in such women. Always remember, once a month pill, only thing you have to remember is a combination is given. a combination of two things. What are those? The first one is quinistrol. What is the combination known as quinistrol? Quinistrol contains long acting estrogen, short acting progesterone. In combination, they were disappointed. Moving on to male pill or gossipol. Male pill, the four main lines of approach. In the male pill, which is made up of gossipol, which is a derivative of cottonseed oil. You can see that gossipol, a contraceptive for the men, it is made up of cottonseed oil. It causes the inhibition of spermatogenesis, in turn produces azoospermia. So we see that the main focus, before understanding the male pills, know these four main lines of approach in cases of male pills. First thing is to prevent the spermatogenesis, the formation itself, preventing the formation. And the second thing, interfering with the sperm storage and maturation. First, they are interfering, their approach is to prevent the production. Second is to interfere with the storage and maturation. In the third place, preventing the sperm's transport in the vas deferens. Fourthly, they are altering the constituents of the seminal fluid. This, in an ideal male contraceptive, it will decrease the sperm count while leaving the testosterone levels normal. Remember guys, it will only affect the sperm count, whereas the testosterone, the hormonal level will be normal. A male pill, which is gossipol. We have to remember male pill gossipol. Gossipol, it is a derivative of the cottonseed oil. It is effective in producing azoospermia, also severe oligospermia. But as 10% of the men will be permanently azoospermic after taking it for 6 months. It is, if the man takes the gossipol for 6 months, he will be permanently azoospermic. It will prevent the production of sperms completely. Further, the gossipol could be toxic. This animal study showed that it had both toxic effect as well as a certain effective level. At present, it does not seem that gossipol will be widely used. Then the other contraceptives, we have drogestrel, which is an oral contraceptive pill for the male. Degogestrel and testosterone is given in combination, which is 100% effective. It blocks the sperm. It may cause electrolyte imbalances in the body. Drogestrel. Then we have adjudin. An adjudin, which is a non-hormonal male pill. It is an analog of ionidamine. It is an anti-cancer drug. This also inhibits the sperm maturation. The fertility in cases of adjudin will return within 1 year. So we saw that in cases of gossipol, 6 months a continuous usage can result in complete azoospermia. Whereas in adjudin, it is seen that the fertility is returning within 1 year. Catspir is a gene blocker. It blocks the calcium channels. You can see here, Catspir ion channel. It is blocking the calcium channel, and no calcium will result in the loss of motility in the sperm. It is effective both in cases of males and females. The fertility of the sperm is altered by blocking the calcium channels in cases of Catspir. Guys, for your UG level, you have to remember male pill gossipol. This is very important. For the pre-PG examinations, you can prepare about drogestrol, adjudin and Catspir. Catspir blocks calcium ion channels. Adjudin, what does it do? It is a non-hormonal male pill. It will inhibit the maturation. So remember, adjudin is concerned with the maturation and drogestrol is concerned with the blockage of the sperm. It is resulting in electrolyte imbalances in the body. Male pill gossipol is all you have to remember, which is a derivative of cottonseed oil, which will produce azoospermia in the body. Moving on to the mechanism of action in cases of oral contraceptive pills. So before understanding the mechanism, let us summarize the OCPs. So far, what did we study? Oral pills and depot formulation is the classification. So under the oral pills, just a second, yeah, Under the oral pills, we have 5 subheadings. What are those? The first one is combined pills, progestogen only pill, that is POP. Third, we have postcoital pill. In the fourth, we have once a month pill, and fifth, we have male pill, gossipol. So we studied all 5: combined, progestogen only, postcoital, once a month, and male pill. Let us see what is the action of this OCPs. In cases of combined pills, they will prevent the release of ovum from the ovary by blocking the pituitary secretion of gonadotrophin. So we know that gonadotrophins will go stimulate the pituitary gland, which releases FSH and LH, which will go act on the ovaries and result in the maturation of the like the primary follicle and everything in Graafian follicle, release of ovum. In cases of combined pills, they will prevent the release of ovum from the ovary by blocking the pituitary secretion of gonadotropin. In cases of progestogen only pill, the progestogens mainly act on the cervical mucus. It will alter the cervical mucus, make it thick and scanty. When the cervical mucus becomes all thick and scanty, thereby it prevents the sperm's penetration further. It also inhibits the tubal motility and delays the transport of ovum, and the ovum dies there. It has to transport within the specified time and then reach the sperm before the sperm dies in the body. The right time the fertilization has to occur. In case the motility of the fallopian tubes is altered, then the ovum will not meet the sperm and fertilization cannot occur at the appropriate time. So we see that combined pills in the first place, which will affect the ovaries, pituitary secretion of gonadotrophins, thereby preventing the secretion of ovum from the ovaries. And then we have progestogen only pills. They will act on the 2 places. One is the cervical mucus. So we see with the help of this, let us see. What do? They will act on the cervical mucus. Acting on the cervical mucus, what did they do? They made the mucus thick and scanty. Whereas the other one, it affected the tube's motility, movement. The motility is the movement. Okay, clear. Next, withdrawal bleeding. So what are they speaking about? Withdrawal bleeding. Now let us see. Withdrawal bleeding, when there is a stoppage of OCPs after 21 days, they will cause withdrawal bleeding. Withdrawal bleeding is not like that of a normal bleeding, but it is just an episode of the uterine bleeding from an incompletely formed endometrium, which is caused by the withdrawal of exogenous hormone. So whenever the exogenous hormone intake is stopped, it will result in the unevenly formed or incompletely formed endometrium to be shed off. Once the exogenous hormone stops, then the bleeding occurs, which is nothing but the withdrawal bleeding. Moving on to the adverse effects of OCPs. Starting with the general effects. In the general effects, we have weight gain. The weight gain probably is because of the water retention in the body. Then we have breast tenderness, premature cessation of lactation. So remember, OCPs in cases of lactation, they will produce the premature cessation of the milk production, the stoppage of milk production prematurely, or decline also in the milk volume. The quantity of the milk secretion will be reduced. Headache, migraine, bleeding disturbances. These are the general effects. What are those? Weight gain, breast tenderness, premature cessation of lactation, headache, bleeding disturbances. Metabolic effects. In cases of metabolic effects due to the progesterone component, we have increased BP, increased blood sugar, increased plasma insulin. We also have dyslipidemia because of the decreased HDL. In cases of cancers, we have CA cervix, breast cancers, hepatocellular adenoma. So we see here these OCPs can result in Metabolic effects. Under the metabolic effects, remember guys that they will decrease the high density lipoprotein, the blood clotting will be affected, the carbohydrate metabolism will be altered. As a result, the blood glucose levels and the plasma insulin will elevate in the body. So you have to remember it in a logical way. Just don't remember, memorize, or by heart each of them. Metabolic effect, what happens in the body? There will be an elevation of the blood pressure. One thing what happens, there is alteration in the lipids, there is decreasing high density lipoproteins are coming down. So the particular effect on decreasing the high density lipoprotein, once the lipids are altered, the blood clotting, the carbohydrate metabolism is altered. Resulting to the carbohydrate metabolism, there will be elevated blood glucose and plasma insulin. They are usually related to the progestogen component. Now, next we have the cancers. In cancers, what did we see? Carcinogenic effect. We see that the hormonal contraceptives are indicated as a trend in increasing the risk in cases of cervical cancers. Increased duration of use of OCPs is being explored in cases of breast cancers, and hepatocellular adenomas are also seen. Hepatocellular adenoma and gallbladder diseases can also be caused by the use of the pills. Cholestatic jaundice can occur in it is usually seen in cases of the pill users. Cholestatic jaundice, gallbladder diseases, cholestatic jaundice, and monoleal vaginitis or candidiasis. So we can see that the women can also come up with the vaginitis, candidiasis, the fungal infections. And then we have cardiovascular effects. We see that from the progressive reduction of estrogen content, which is to the minimum levels it has been bought, it is very necessary so that the contraceptive effect can be maintained, and also the cardiovascular changes should not occur in the body. So what did they do? They bought the estrogen content to the minimum levels necessary to just maintain the contraceptive effect. Because of these findings, in spite of this reduction and finding out and reducing it, even though there is a reduction to the least minimum level, it is very clear by 1980 that the vascular effects like hypertension still persisted. Along with hypertension, we also get to see the metabolic effects, like we saw that blood pressure, the sugar levels, and all that were altered, which was directly related to progestogen levels. And also, we have atherosclerosis, leg vein thrombosis, myocardial infarctions, and stroke. So these were the adverse effects. We see blood pressure, cardiovascular accidents, that is stroke and so on, weight gain, cancers. So here let us stop the video and continue the other part in the next video. Thank you.